Hi guys, it's Dale with E-Insurance. Today we're gonna talk about an article we've done on healthcare. It's actually titled "An Overview of the Republican Healthcare Plan," the GOP healthcare plan. Um, I will preface this with saying, obviously, this can get intricate and mundane. So if you want a more detailed overview, or you want to get into the weeds about their plan, go to the link below. Otherwise, I'll do a quick summary to touch on basically the four major points of the plan. The first is kind of what they call uh, personal portable healthcare. They've essentially added what they call a health reimbursement arrangement, and it allows companies to actually invest pre-tax dollars towards your health plan. So it functions sort of like a health savings account, but as you know, a health savings account, anyone can invest into that account. It's owned by the individual. And then the IRS actually dictates what expenses are allowed for you to use on a health savings account. For this health reimbursement account, this HRA account, it's owned by the company. The company approves the expenses in which you can use it for, but it can be used towards your individual insurance policy. And because the company owns the HRA account, if you leave the company, the HRA account stays there. Whereas with an HSA, the company can contribute, you can contribute, anybody can contribute to that. But if you leave the company, that obviously stays with you. So keep that in mind when you're deciding or reviewing, do you want an HRA or an HSA type account. The next point has to do with telemedicine. Telemedicine is becoming really popular now that we're at an age where people are very comfortable with going online, doing searches, digesting information. Now you can actually consult with the doctor digitally, whether it's through kind of Skype or just through email or texting. You can get a diagnosis, you can get a prescription, you can have a doctor's visit. What the GOP is trying to do is remove barriers so that telemedicine is more available under different insurance plans. So for instance, with their plan, it'll be available to Medicare patients. Another big point are the tax advantages. It kind of levels the playing field for those that don't have employer insurance from the tax benefit standpoint. So if you have non-employer coverage, you could, for instance, use your health savings account towards any insurance expenses, and the premium you pay for that for your insurance is tax deductible. Last and not least, and this is probably, I don't want to say the most important, but it's kind of near and dear to my heart. For the chronically ill, the GOP plan actually allocates more funding to those carriers that take on those patients that are chronically ill that have very expensive treatments. So it's kind of incenting them to hey, don't stay away from this chronically ill pool. We'll actually fund you, give you extra funds to take on that that individual, to care for that individual. So those are kind of the four major points. Once again, if you want to get into detail about the plan, just visit the link below. and there's more than enough information there for you to digest. Thanks very much, and I hope this is helpful. Bye.